All right, the next question we're going to answer is, what are the primary benefits of residential inpatient treatment?
I mentioned earlier that I have 27 years experience in the field and profession of addictions treatment, and I've worked in both and run both inpatient and outpatient treatment programs. My experience shows clearly that inpatient treatment works much better than outpatient treatment. And I think the importance is that they have a really safe place to go to and to be for an extended period of time, whether it be 30 days or beyond. And again, like I said earlier, after about 7 to 10 days, quote, the light comes on. So one of the most important things about residential that sometimes doesn't happen in outpatient treatment is they break the addictive cycle. When you're on an outpatient basis, you go home every night or you go to work every day or you do whatever you do, and there's just too many more opportunities to continue in the addiction. When you're in a residential setting, that isn't the case. Another thing, too, and I think we alluded to this earlier, one of the primary symptoms of the addiction is loss of control. And you lose your loss of choice, or you lose choice, freedom of choice, and the addiction. And one of the things that can happen here is you once again regain an ability to make a choice, make a clear-headed, conscious choice. So Tammy mentioned relapse a while ago. So once you leave residential treatment, then it's incumbent on the individual either to make a decision to drink or use or not to drink or use. And that happens every time you run up against it. But as long as you don't use, you have the freedom of choice to say, no, I don't want to do that anymore.
So those two benefits. You get to break the addiction cycle, and then you recognize the ability to make a choice. Exactly. Whereas before, you've lost control, and you're definitely have a...
You're incapable of making a right choice when you're loaded. Absolutely. I tell people their brains are like an electronic circuit board. And through the process of us using drugs, it's like pulling out all the wires and then randomly poking them back in. That's your brain when you come into treatment. And you need to be put through a medical detox while you carefully take the wires out and try to re-plug them into the right place. And that process, as I mentioned, takes 7 to 10 days, and then your body begins to feel better. The brain is reproducing serotonin, dopamine, the natural chemicals that it makes, so that we can get through our day and feel some pleasant things, our sense of taste comes back, all of that. That's not going to happen if you're a full-blown addict or alcoholic and you do IOPs first. So there's many, many benefits to inpatient over outpatient.
Another thing, too, which I didn't mention, is the education that you received in residential treatment. It's more intense than you may receive some of the same information outpatient, but here you get it in a more condensed
yeah, absolutely.
And it seems like when you're in inpatient, normally people know, even though they might be in denial to a large degree, they also, in the back of their minds, know they've got an addiction problem. But the other part of it is, they can say, I've got an addiction problem, I need to do something about it. The willpower thing for sure isn't working, but then they're going to the next step and saying, okay, I'm going to inpatient treatment, and all of a sudden I'm given an education and a set of skills that prior to this, I didn't have. And so when I leave, the idea is that I'm working to break the addiction cycle, I'm learning how to say no, and then the other part is getting skill sets that you never had before you got there.
So if they leave treatment and they go out and use, they have been taught where the answer lies. So I always tell people, you'll hear our voice in your head for years to come. So if you go out and get loaded, that's okay. Everybody falls off the horse now and then. But the thing is we forever ruined it because there's that voice in the back of the head that knows better. I do have an option now, so.
Makes good sense.